Good morning, students. So, continuing with the history of the lymphoid tissue, lymphoid system, we are going to talk about appendix. Why are we going to talk about appendix? Because appendix is a very good example of MALT. What is MALT? Mucosa associated lymphoid tissue. So, what are you seeing? First of all, you have to identify this slide as appendix. How do you identify? Well, the structure of the appendix is very similar to colon. Means you will have crypts. You will have the crypts of Lubacune. Then you can see there are plenty of goblet cells. So in GIT, as you go from above to below, you will see that the goblet cells increase in number, and it is maximum in colon and appendix. So a lot of goblet cells. What are goblet cells? Goblet cells are unicellular mucus gland. So you can see crypts. These are the crypts. Okay, and then you can see plenty of goblet cells. The lining epithelium is simple columnar epithelium. So once you identify that this is a slide of appendix, then you can see further other things which will help you to further identify as appendix. Here you can see this structure, that is the muscularis mucosae, and in the submucosa you are seeing large aggregation of lymphatic tissue. So the last aggregation of lymphatic tissue in the submucosa and the structure similar to colon will help you to identify this slide as appendix. So I have taken an example, appendix as an example to demonstrate mucosa associated lymphoid tissue, that is MALT. So what is MALT? So mucosa associated lymphoid tissue. So in the appendix, in the submucosa, you are seeing large aggregations of lymphatic tissue. So in the lymphatic system, we have seen in the previous slides, we saw spleen, lymph node, thymus, and then we are seeing appendix, which is an example of mucosa associated lymphoid tissue. Once again, what are the important identifying points? The crypts of Lubacune, lining epithelium is simple columnar epithelium. You have plenty of goblet cells which are empty looking cells because mucus is not stained by H&E staining. So the cells look empty. They are all goblet cells, so nothing but unicellular mucus gland. They secrete mucus. Then you see the muscularis mucosa. Then you have the submucosa. So this is the mucosa. This is the muscularis mucosa, which is a part of the mucosa, and then you have the submucosa below the muscularis mucosae, and in the submucosa we see large aggregations of lymphatic follicles. So that is the MALT, M-A-L-T, mucosa associated lymphoid tissue. Now this is how you identify the slide of appendix. Once again, I will be revising the appendix slide in the GIT section. Thank you.